Right now, you're surrounded by pressure. It's the weight of the atmosphere of air. We call this 1 bar or atmosphere. When you go underwater, the water adds to this pressure. 10 meters, 33 feet of water adds the same pressure as the 1 atmosphere of air. So, the pressure increases 1 bar or atmosphere for every 10 meters or 33 feet you descend. Increasing pressure doesn't affect water, but it compresses a gas, like air. So as you go deeper, pressure reduces an air volume and increases its density by pushing the molecules closer together. This pressure-volume density relationship is important because it affects air spaces, including your ears, sinuses, lungs, and mask. It also affects controlling your buoyancy and how long your air lasts. As shown here, there's a relationship between the pressure and a gas's volume and density. At 10 meters or 33 feet, the pressure is twice the surface pressure, so half the air volume remains and the density doubles. The same relationship applies when you ascend. As the divers ascend, the gas re-expands so it's full of air at the surface. But what would happen if the divers inflated a balloon and sealed it at depth, then ascended? The air would expand and burst the balloon. To prevent this, the divers must keep the balloon unsealed and release some expanding air as they ascend. This is a very important concept we'll return to shortly. As you descend, water pressure compresses the air in your body air spaces. When descending, this primarily affects your ears, sinuses, and mask. A squeeze is discomfort caused by the imbalance between the water pressure and the airspace. A squeeze can injure you if you continue to descend. But you can prevent a squeeze by adding air to air spaces to balance the pressure. This is called equalization. Equalize your ears and sinuses by blowing gently against your blocked nostrils, or by swallowing and wiggling your jaw. Blow through your nose into your mask to equalize your mask. Equalize frequently as you descend before you feel discomfort. You shouldn't ever feel pain. If you can't equalize, stop your descent. Signal your buddies or the instructor. They can't tell that you're having difficulty unless you do. Ascend slightly and try again. If you still can't equalize, discontinue the dive and try another day. Continuing to descend with unequalized air spaces can lead to serious injuries. A cold or allergy that causes congestion can make equalizing difficult or impossible, so don't dive until you're well. Equalize gently. Never attempt a forceful and/or extended equalization. A forceful extended equalization can cause serious, permanent ear injuries. Earplugs create an airspace that you can't equalize, so don't use them while scuba diving. Increasing pressure may affect other body airspaces. It's rare, but an airspace can form under a tooth filling and cause discomfort. There's no way to equalize this, but your dentist can correct it. A dry suit holds an air layer around your body that compresses. You learn to add air to equalize it when you take the PADI Dry Suit Diver course. Air expands as you ascend, and normally exits your internal ear spaces, mask, and sinuses without doing anything. But expanding air can be a serious issue related to your lungs. Using scuba, your lungs are at normal volume at depth. If you were to hold your breath and ascend, expanding air would overexpand and rupture your lungs, much like it bursts a balloon filled and sealed at depth. For this reason, the most important rule in scuba diving is to breathe continuously and never, ever hold your breath. Even small depth changes can cause lung overexpansion injuries. If you hold your breath, lung overexpansion can cause severe injuries, including paralysis and death. Medical treatment requires a pressurized recompression chamber, but diving commonly takes place several hours from such chambers. But while lung overexpansion injuries are very serious, they are also very easy to avoid. Breathe continuously and never hold your breath while scuba diving. This way, during ascent, expanding air escapes without issue. If you don't have your regulator in your mouth, exhale a slow, steady bubble stream so you don't hold your breath. Also, never dive with lung congestion, which has some risk of trapping air in your lungs and causing overexpansion injuries. It is rare, but some body air spaces may have a reverse block. This means expanding air can't escape. Diving with a cold or allergy can cause a reverse block, but again, you shouldn't dive with a cold. Gas forming in your digestive system can cause some discomfort if it doesn't pass. And an airspace under a dental filling may, again very rarely, cause one. If you experience a reverse block, stop your ascent. Descend a meter or a few feet or so, and give the trapped air time to work itself out. Then continue your ascent more slowly. As you've learned, as you go deeper and the pressure increases, the more a gas volume decreases. This means that the deeper you are, the more air each breath uses from your cylinder. So the deeper you are, the faster you use your air. Because the air is denser with depth, it takes more effort to breathe. Take slow, deep breaths while scuba diving. Pace yourself and avoid getting winded or out of breath. If you have a problem, stop and maintain or restore slow, deep breathing. As a scuba diver, 1. Breathe continuously and never ever hold your breath. 2. Breathe slowly and deeply. 3. Don't allow yourself to get winded or out of breath. And 4. If faced with a problem, stop and maintain and/or restore slow, deep breathing. When you put something in water, buoyancy pushes the object upward. The upward force is equal to the weight of the displaced water. Whether something floats, sinks, or does neither depends upon whether it weighs less than, more than, or the same as the water it displaces. As a diver, you primarily use your weight system in BCD, buoyancy control device, to control your buoyancy. As you descend, you tend to lose buoyancy. You add air to adjust for the change. When you come up, you become more buoyant, so you vent air to adjust. You'll discover that even breathing changes your buoyancy. It increases slightly when you inhale and decreases slightly when you exhale. By mastering buoyancy control, you enable yourself to control your descent and ascent rates, to stop at any depth, to save energy, to stay off the bottom, or to float comfortably on the surface. Recreational divers do not dive alone. You always dive with a buddy or buddies. Together, you plan your dives, help each other gear up, safety check each other, provide dive time reminders, assist with problems, and assist with the dive objective. The buddy system is important for practicality because you assist each other, and for safety because you can help each other prevent and handle problems. It's also important because diving is a social activity. You'll find diving is more rewarding and fun simply because you get to share your underwater adventures and experiences with others.
You dive relaxed, but like any sport, diving can be physically strenuous, such as when walking in your gear, swimming in a current, or when responding to an emergency. So, stay reasonably fit with a regular exercise program approved by your physician. Eat well, get adequate rest, and keep immunizations current. It's also a good idea to have a physical examination regularly. Like any physical activity, diver stresses put demands on your heart and cardiovascular system. This can happen lifting and carrying gear due to heat stress from wearing exposure suits in the sun, and so on. These factors can cause heart attacks in predisposed individuals, and they can be issues for other cardiovascular conditions. If you have or may have increased cardiovascular risk, be sure to discuss it with your physician. Never use alcohol or tobacco prior to diving. If you drink, use moderation the night before diving. Some drugs can create problems while diving, so be cautious and consult your physician if you're unsure whether you can use a particular drug. You want to be in good physical health when diving. If you feel ill, cancel the dive. Dive again when you're well, and as you've already learned, don't use medications to eliminate symptoms and dive while you're sick. Diving is supposed to be fun, and you enjoy it by diving when healthy. Like in any activity, you keep your dive skills and knowledge sharp by using them and by diving regularly. If you can't get to open water, practice in a pool with a buddy. Staying up to date includes interacting with other divers and online communities like Scuba Earth because it helps you keep up with current trends and practices. If you go more than 6 months without diving, see your PADI instructor about refreshing your knowledge and skills in the Scuba Review program. Continuing your diver education is a great way to stay sharp because you use existing skills while developing new ones. You can do this in the PADI Advanced Open Water Diver course, specialty diver courses, and other programs that expand your experience and qualifications. Most recreational diving uses air as a breathing gas. Air is actually a mix of gases. Practically speaking, it is 21% oxygen and 79% nitrogen. We'll look at 4 issues that relate to breathing air underwater: oxygen toxicity, contaminated air, decompression sickness, and gas narcosis. We'll look at oxygen toxicity, contaminated air, and decompression sickness in this section, and gas narcosis later in Section 5. Although we need oxygen to live, under pressure, oxygen becomes toxic. It also has fire and combustion issues with equipment. When using air within recreational depth limits, though, neither of these are significant issues. Enriched air nitrox, however, is air enriched with oxygen, so it has a lower nitrogen proportion and a higher oxygen proportion. This has advantages compared to using regular air, but oxygen toxicity and equipment concerns can be issues with enriched air nitrox. You can learn to handle these issues in the PADI Enriched Air Diver course. But until you're certified as an enriched air diver, don't use a cylinder labeled as an enriched air cylinder. Contaminated air is air with impurities in it. It's very rare in diving. Contaminated air may smell or taste bad, but not necessarily. Signs and symptoms of contaminated air include headache, nausea, dizziness, unresponsiveness, and cherry red lips or nail beds. Never dive with air that smells or tastes bad, and end the dive immediately if you start feeling ill. Have a diver who may have breathed contaminated air breathe fresh air and provide oxygen if available. Contact emergency medical care. Avoid contaminated air by getting your cylinder filled only by reputable professional scuba centers. These operators use specialized breathing air compressors and filters and know the value of regular air testing. You've learned that you have time limits underwater beyond how long your air lasts or how long you stay warm. One of these comes from nitrogen. During a dive, increased pressure causes nitrogen to dissolve from your air into your body tissues. The greater the pressure, that is, the deeper you are, and the longer you're down, the more nitrogen dissolves into your body. Your body doesn't use nitrogen, so when you ascend and the pressure drops, this excess nitrogen dissolves back out of your body tissues. If the extra nitrogen isn't excessive, this happens harmlessly. Your dive computer, or tables like the RDP table or ERDPML, helps you keep excess nitrogen within accepted limits. More about this shortly. If there's too much dissolved nitrogen, however, when you ascend, it may come out of solution faster than your body can eliminate it. Bubbles can form in body tissues, causing decompression sickness, which is a serious medical condition sometimes called the bends or DCS. Signs and symptoms include paralysis, shock, weakness and prolonged fatigue, dizziness, numbness, tingling, difficulty breathing, limb and joint pain, and in severe cases, unconsciousness and death. DCS signs and symptoms may be obvious, but they can also be subtle, like a mild to moderate ache, weakness, or prolonged undue fatigue. They occur within 15 minutes to 12 hours after a dive, though some longer intervals have occurred. Symptoms may be intermittent. Regardless, treat all suspected cases of decompression sickness as serious. We'll look at the first aid for it in Section 5. Time and depth primarily influence how your body absorbs and releases nitrogen, but physiologists think some other factors predispose people to DCS. These include fatigue, dehydration, vigorous exercise, cold, poor fitness, illness and injuries, alcohol consumption, and age. In the next subsection, you'll learn how to help adjust for these if any of them apply to you.